The project has actually been underway for about a year now, and currently we've collected all of the Silica data, and we've been processing that. I talked about here at the conference about how it's important that we make sure that data is of sufficient quality that we can trust it. A lot of it is pulled from various sources. So we have the data, and now we're actually developing the internet tool that will allow employers to access it easily. So it's going to be a phased kind of approach. The tool is, at the moment, as of November the 13th, still being coded by our IT team, but pretty soon we'll have a version that's available for an initial set of users, and once we're confident that it's sort of unbreakable, and then we'll go to a slightly larger group, and then finally we'll release it for general use probably sometime in the spring. This is a partnership, this project between ourselves at UBC, BC Construction Safety Alliance, and WorkSafe. So we want to make sure that what we're doing is it's scientifically robust, but also meets the sort of compliance needs for WorkSafe. So it's a very good partnership. We've worked with them and said, well, what kind of data is of sufficient quality? So was the measurement data that we're going to use collected using standard methods? So people might know NIOSH methods or WorkSafeBC methods. Was it analyzed by a lab that has trustworthy and is a certified lab and so on? So it's that kind of thing, you know. It's basic quality assurance. Recognizing that having numbers, quantitative data is really important to understanding, first of all, the problem, how to fix it, but then also to sort of see how we're improving things over time. You need to collect data. You can't see these subtle changes that are really important to people's health. You can't detect that without numbers. So then you're saying, okay, well now we want to collect data, but that's expensive to have every company going out and collecting data on every time they have to do a risk assessment. So what we're proposing, and what we've seen a lot of support for, is that if we guarantee certain things around security of the data, anonymity of the data, then what we're hoping is that those working in the construction sector will be willing to share information. It's not a huge concept, right? It means that one company needs to collect data, then they're willing to share that on that particular instance. And then maybe another company does measurement on some other Silica scenario, they collect data and share it. And so we're building like a library of information about Silica exposure with everybody contributing and everybody at the same time benefiting. There's definitely been, I think, some of the best advances in health and safety occur when everyone's working together. They can be quick and they can be really important. But to be honest, especially in the area of exposure assessment, quantitative data, it's been a bit of a disappointing area for the last 20 years or so. We used to do a lot of exposure measurement. The political environment, the regulatory environment changed. There's been less and less measurement data, but now that's starting to hurt us. People realize you need numbers. It's like the long-form census, you know. If you don't have data, everybody suffers. It's not just the regulator, but it's hard for people to protect their employees because they can't tell if they're making a difference. So what we're doing is the WorkSafe has said that they want this a quantitative-based tool or a quantitative-based regulation, which is good. So what we're saying is, okay, now how we can make that most cost-effective by having people contribute and share information. We've talked a lot about the numbers. There's definitely what we're aiming to do is make that a part of the overall objectives of this. We're hoping that we'll have really a sort of one-stop shopping for all things Silica, especially in the construction sector, so that employers, when they're faced with an issue about Silica, they're going to think I want to go to that website, and certainly there'll be this quantitative aspect of the exposure control plan, but there'll also be documentation, expert content on how to do things right, and potentially we're even thinking that you could have up-to-date information on where training is going to be available, which consultants to go to. So really something that people want to go to and visit when they have silica issues of concern.